In other news, doctors say the Health Minister is in denial about how bad the sector really is. They say it's at breaking point with staffing shortages, and unless something is done now, it will collapse. The Association of Salaried Medical Specialists annual conference telling the Health Minister they're overworked and exhausted.
I'd like to know what you're going to do for us in terms of retention, because a lot of us are leaving and burnt out.
It is insane. And why are we in this position?
The conference heard 1 in 10 doctors are looking to leave.
For those of us at the front line, there really isn't any hope that things are going to get better.
There is a crisis. That is what they perceive, that is what they observe, that is what is causing them genuine, what we call moral injury, and being unable to practice safely.
But the Minister refuses to accept there's a crisis.
I've repeatedly acknowledged the incredibly challenging circumstances that we're in, and we are.
Those circumstances, a tough winter off the back of 2 years of COVID. His response a bit weak for these doctors.
What our members, who are senior doctors and dentists, largely hospital-based, are saying is that daily they are under crushing pressures.
Daily pressures and the worry that promised relief will be too late. Well, joining us now is National's health spokesperson Shane Reti. Kia ora, Shane. Thanks very much for joining us. Those doctors today saying the health system is in crisis. Is that the word that you would use?
It is absolutely the right word to use. There's only one person in New Zealand, Andrew Little, who thinks the health system is not in crisis. He is wrong. We have a crisis.
OK, so Andrew Little up on the podium there today. If you had been in his place, what would you have said to those doctors?
I'd have said to them, look, I acknowledge there is a crisis. Here is the plan that I have. Stick with me. Here's the pathway to see ourselves out of this crisis. That's what I'd have said from the podium.
Well, I think the Minister has said that they have a pathway. Help is on the way. It's just not happening soon enough. So how would you remedy that?
Well, no one believes that there's a pathway. We've yet to see it. And in fact, the easiest cost-free pathway is to turn on the day one pathway to residency for gastroenterologists and neurologists and people in the audience who are short-staffed in those particular areas. That's the pathway that could turn on today.
There are factors, though, beyond the government's control. We have got COVID, decades of underinvestment, global staff shortages. Is it even possible to fix this?
Yes, I don't accept that we throw our hands in the air and blame everything for COVID. COVID is sanitised bad behaviour. Let's look at ED specialist John Bonning and the ASIM team, who very clearly said, Minister, this is not a COVID blip. We have control of large parts of this in our hands. We could turn on the day one pathway to residency tonight as we speak.
What's this bad behaviour you're talking about? Who's responsible for that?
Oh, blaming COVID. Everything's due to COVID. The waiting lists are due to COVID. The surgical lists, ED wait times. You know, if you go to the 2 years before COVID even arrived, the waiting lists were quadrupling already. So I don't believe and don't accept that it can all be blamed on COVID. It has been a contributor. I get that, but we can't just say, oh, it's all just a COVID phenomenon.
But some of that is historic as well, isn't it? Some of that is National's fault and previous government's fault.
And I've put my hands up to what we did that was good and not so good in those 9 years. And I don't understand in parts why we didn't build our domestic workforce either. I don't understand that, but I do know what we do differently.
Well, this getting the health organisation into one organisation, Te Whatu Ora, that is a start though, isn't it? That is going back to the real building blocks of the foundation of our health system, and they have made a start on that and they're going to build from there.
Oh, it's a terrible start. Show me one outcome in this 5 months of Health New Zealand that's gone well. Show me how the financials have gone in this past 5 months. Show me one wait list that has done well in this past 5 months. And before you say, oh, it's only been 5 months, no. They had 2 years from when they announced the health reforms and tens of millions of Ernst Young dollars. So I would not say that the health reforms are going well, and they will pay the price for centralising care into Wellington instead of localising it out to the regions.
OK, just quickly, we're almost out of time. If National do become the government next year, what is the number one thing that you would do to fix this?
Health workforce numbers and health workforce morale. You know, you can have the best policies in the world, all the hospitals you want to build, but if you don't have the health workforce to deploy and operationalise the work you need to do, it doesn't matter.
Thanks for your time tonight, Shane.
My pleasure.